Okay, once again we have Ben with us, and we're going to use him as our patient. But one of the things I want you to think about when you're palpating lymph, and you've been asked to palpate the neck, you've been asked supraclavicular, you've been asked to do the axillary region, you've been asked to do the inguinal region. There are certain concerns for all of those, but one that's really important is that what tool do you use to palpate with, and that's your fingers. Now, if I said palpate a pulse, a lot of you would put 2 fingers on a pulse, but what they really want are 3. And so I want you to always consider this, that you palpate with 3 and you percuss with 2 on 2. Let's practice one more time. Palpate with 3, or 3 on 3, or 3 on somebody, but 3. Percuss with 2 on 2. Okay, so those are then your tools. Now, we're going to be palpating, so it's 3. The thing I want you to do to prepare for this is when you're nervous, you do things a little hard, probably firmer than you need to. And remember, these patients are all faking. Ben's not sick today, but if I ask him to fake that he has a sore throat, then he's got to fake that and oh, ow, and pull away. So one thing I want you to do is make sure you've trimmed your fingernails so you don't get fake outs. Okay, so trim your nails down to the nubs for this test because some of you draw blood when you get kind of nervous, okay? So trim your fingernails. Now, what do you think our job is to tell our patient? We're going to tell him that he's going to let us know if there's any pain or discomfort, okay? And we might even proceed with, do you have any allergies or sore throat? That would be okay. If you think you're going to forget it, then throw it in here. But the next thing that you have to do then is to start to palpate. So I want you to go kind of in a circle. And the one thing that we're looking for is that you are not going to bunny hop. So let me show you bunny hopping. Boing, 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 boing. Yeah, so look at your patient. Okay, he thinks it's goofy too. Okay, so realize it's their pressure, then slide, then pressure, then slide, pressure, then slide. And then that should feel like what most doctors have ever done to him in the past. And now, if I get down in here and he pulls away, what is it your job to ask? And I'm going to tell you, your instincts are to say, where? But you know where. It's where your hand was. He even pulled away from the side that hurt. So you full well know where it hurts. So it's not where, it's, do you have a sore throat? Do you have earaches? Runny nose? Eye congestion or runny eyes or red eyes or any problems with the gunk in your eyes. So that's the kind of questions you ask. Now where do we get that little clue? And it says eyes, ears, nose, throat right there. So palpating the neck, it's EENT, eyes, ears, nose, throat. So however you need to remind yourself of that. Now supraclavicular lymph nodes, you can throw in whether they do axilla or neck. They probably really didn't, there's not any points for them, but if you get freaked out, just go out here and just do a little circle out there in the supraclavicular region. Now all of you notice that I've been facing the patient. Some schools learn to do this behind the patient, but the problem is when you're behind the patient, you don't sometimes see the grimace or the ows, and you don't know what's happening. So I really prefer that you do it face-to-face with the individual. In fact, another way to do it is to have him supine on the table and you're doing it there. That way, it forces you to be face-to-face. Now the next one I want to show you is the axilla. Now, there's one thing that I didn't do that I had already done because I had just washed my hands, but let's make sure that we use hand cleaner before we touch this person's face. Alright, now when we do the axillary region, there's a couple of key things that I want you to look for. So one thing I want you to stand up, okay, and is he still on the camera if I have him face the camera like this? Okay, alright. Now, there are a couple of things I want you mindful of. When you were going to be palpating in here, he's kind of ticklish, I already know that about him. I asked his mom. Okay, so I'm going to use a broad contact. So you don't want to just poke on people. When people are ticklish, you use a broad contact. See, because he knows that's coming, it's a firm, and even if he has the idea to snicker, he knows I'm not going to tickle him. Alright, now the next thing I want you to do is, some of you raise the arm up way too high, and that stretches all of this tissue out, and then you can't palpate the individual lymph nodes. So the whole goal here is I want you to look at this, and this is about 30 degrees. We don't even want 45, we want about 30 degrees, just so it's hanging like this, and they'll look to see if you've told the person to relax properly. See, a lot of people when you raise their arm, they raise it up like this, and then you say relax, and boom happens. Okay, so we want him nice and relaxed. Now, I'd like you to practice this asexually or for both genders. So what I want you to do, Ben, is take this hand and place it up here and just traction the tissue that direction. Okay, and I'll help him. See? Now, not that far. Just you hold your hand just like that. So their job is to place their hand here. Now if it was a woman, I'd say put it on your breast and just traction the tissue forward for me. Okay, but this way we're practiced for both genders. Okay, now your job is to palpate 4 walls. So you tell me, I'm going to show you 2 methods. You tell me which one gets all the points. That's method 1. Method 2. Any pain or discomfort back here? Okay, how about inside here? Okay, how about on this outside wall? How about up here in the front? Was that obvious I did 4 count of 4? Okay, go ahead and relax this hand. Now do you notice? He's going to keep his hand there till you tell him to relax. And so will she. And she doesn't want to hold her breast for 5 minutes, okay? So you have to tell the person to relax. And the best way to do it, let's place your hand there again. The best way to do it is to simply touch their hand or to say relax. So either one, go ahead and relax your hand, that's fine, as long as you're not touching their breast tissue, okay, if it's a female. All right, now what should I do now? That's right, the other side. So we have to do both sides. So make sure and remember that you have to do both sides. Now what do we do if we're in here rooting around and he says, ow, see, he knew his word, ow, that's his line. So now go ahead and have a seat. What are we going to say to him? We can't ask about eyes, ears, nose, throat, that's going to be goofy. So what does this drain? And this drains the arm, it drains the chest, and it drains the breast. So we want to ask if there's any drainage from the nipple, if there's been any infections in the arm or sores that haven't healed, if they've had pneumonia or any kind of bronchitis. So we want to ask what I call arm, chest, breast questions. Arm, chest, breast. And again, I put that in your notes too somewhere. Okay, breast, chest, arm. Whatever order you figure it out. Okay, now, the final one, which has not shown up for quite some time, is inguinal. And unfortunately, we got to do that one too. So buck up, buddy. But we're going to pull this forward just a little bit. Okay, you go ahead and lay face up on the table for us with your face down there. Okay, now on this one, if this shows up, and it hasn't shown up for quite some time because I think there's a lawsuit going on about the femoral artery or something down here, but the inguinal area is in a private area, okay? So what we're going to have the patient do is protect their private region. So with your own hands, I want you to protect your private region, okay? I know, it's a little goofy. Okay, and then we place this knee up like this, and you're going to go in, okay? And you see if his hand's kind of in my way, I can place my hand on his hand without touching his genitals, but I can palpate this area and not get into any trouble, and then I can come over and do the other side. But then the important thing to say now is, go ahead and relax. Now, what's always nice at the end of this is that you offer the patient, you know, here's the hand cleaner, I just go, would you like some? And that's fine. They want it, they don't want it, it's up to them, but that way it's been offered. So this is the inguinal. Now, what if he had said ow during that? Okay, you're thinking about it? Because eyes, ears, nose, throat ain't going to work. You can't ask about chest, breast, arm. So now we're going to ask about sores on the legs, we're going to ask about sexual activity, we're going to ask about the private things, okay? So we have to be ready and prepared for that. So you might have to ask about sexual activity, if they're practicing safe sex, if they have multiple partners, if they know the health history. So you've got all that agenda to take care of if this shows up. Now so far, it hasn't for quite some time. But remember, one of the key things is to bend this so that you can get into this tissue easier. Because if you leave them like this, to get in there, you got to really get into some private areas, and so it's a whole lot better to put them in what we call the position of 4. Now, just so that you remember, if it is a supraclavicular issue, I've put a little lymph man over here for you, reminding you that when we talk about the lymph are going to drain from a very small region into the right supraclavicular lymph node. So from the head, the arm, and the chest. But if you have a left supraclavicular lymph node problem, you really have to do, what do you think ROS stands for? Review of systems, because you've got to check the entire body and see where the actual problem is, or if multiple systems are involved and indeed you have a systemic problem. So this is just reminding you if that's part of the case, because it'll be the right answers to pick in the follow-up room, the post-encounter probe room. So those would be pretty advanced cases or systemic, especially with left. Now there are 3 words when it comes to lymph that are really important: lymphangitis, lymphadenopathy, and lymphoma. If you can dial back for a minute, lymphangitis in part 2 and 3, we always talk about red spread dead. Okay, red spread dead. Remember, I even got permission from Mayo to use that phrase. They liked it. So red spread dead is all about the fact that if we see a red spread, we are worried that they need to get right to the emergency room. And lymphangitis is one of those red spread deads. And that is a streak up the arm or a streak up the leg that says you're not controlling that infection. So if you'll notice, it's the only ER up here, okay? So what is lymphadenopathy? Well, that can be from some swelling from TOS. It could be from maybe Hodgkin's putting some pressure on some lymph tissue, or a lipoma, or so it could be from very bad to not so bad to who knows what it is, but we certainly have to find out. Maybe you've been in a cast for quite some time and there's some swelling, or maybe you've had a mastectomy and there's some scarring and stricturing. So those are all probably things that maybe some motion will help most of them. So you usually are part of the solution there. A lymphoma definitely has to be biopsied and find out if it's benign or malignant, but usually isn't going to kill you within the next 24 hours. So the emergency then is lymphangitis. Now, most of your patients are about junior college mall age, so they go from about Ben's age all the way up to as old as they can find, but they try to make it, 50s, 60s is the oldest patients you're going to be dealing with, and they try to get them that are healthy patients so they can play act the sick parts and do that for you. So you can almost guess that your lymph case is going to be mono, Hodgkin's, or AIDS, because that's the 20s, 30s, 40s, 50-year-old kind of disease patterns that show up there. Once we get kind of 50, 60, multiple myeloma becomes the issue, and then it's going to be a multiple myeloma versus lytic Mets. Which one is it? So we'll talk about that when we get into x-ray. But I want you to realize that when we're talking about these, that a chest film is what's going to be in the next room, and it's going to help you. Because whether the lymph tissue is swollen or sore or whatever, it could still be all three of these. But if the chest film looks normal, it's mono. If the chest film has the mediastinal widening, those potato signs, that boxcar look, then that's going to be your Hodgkin's. And if there's a variety of things going on in the lung tissue, the heart looks enlarged, it looks like there's some fluid, it looks like there's a couple lesions or two, then that is probably the AIDS patient with immunodeficiency and quite ill. Now this next line up here reminds you how you confirm it, but infections are basically confirmed with cultures. That's what heterophile agglutination and Paul-Bunel are. When we take a look over here, we know that AIDS is confirmed with the ELISA followed by the Western blot. But what is Hodgkin's? It is a cancer. So it is confirmed by biopsy.